So they are going to learn about how to write a pathophysiology. So in nursing exams, writing about a pathophysiology typically involves answering questions related to a specific disease or a medical condition and its underlying processes. So here's a guide on how to approach a pathophysiology question in nursing exams. So number one key point is read the question carefully. So start by carefully reading the question to understand what specific information is being asked for. So pay particular attention to keywords or phrases that indicate what the examiner is looking for. Then number two, understand the disease. Understand the disease is a second key point. So if the question mentions a specific disease or condition, make sure you have a good understanding of its pathophysiology. So this includes its etiology or cause. Then also consider the risk factors and also the key pathological processes. Then the third key point is use the PQRST method. So this stands for number one, predisposing factors. Then number two, we have the Q, which is for quality of the symptoms. So this is something that you also need to consider. Quality of the symptoms. Then the R basically stands for the region or radiation. Then the S stands for severity of the disease or condition. So applying this method can help you systematically address the pathophysiology of the disease and its clinical manifestation. Then the fourth one is start with a brief introduction. So this is something that will bring in the interest of the lecturer or your examiner or any person who is marking your work. So begin your answer with a concise introduction that states the disease and also discussing its relevance. Then 5, we have explain the pathophysiology. So this is basically the key main factor. So describe the abnormal pathological processes or mechanisms and underlying the disease. Discuss the key alterations in cellular or organ function, changes in biochemical pathways or disruptions in homeostasis. Then the 6th one is link the clinical manifestations. So signs and symptoms are basically one of the key factors. So connect the pathophysiology to the clinical manifestations or symptoms associated with the disease. So explain how the underlying mechanisms lead to observed condition. Then number 7, we have the part which includes the risk factors. So applicable, mention any predisposing or precipitating factors that increase the risk of the disease that exhibit its symptoms. Then number 8, we have the diagnosis and treatment. Okay, so briefly mention how the disease is diagnosed and the common treatment approaches. This shows your understanding of the practical aspects of the nursing care. Then number 9, we have case studies. If relevant, that is if it's relevant or if you're able to remember them. So if the question presents a patient scenario, use it to illustrate your knowledge by applying the pathophysiology to a specific case. Then number 10, conclude concisely. So summarize your response by reiterating the key points you discussed. This can be a brief restatement of the main pathological processes and their clinical implication. Then number 11, be clear and concise. So avoid unnecessary details and focus on the most important aspects of the pathophysiology. Use clear and simple language. Then we have the fourth one, which is use nursing terminologies. Okay, so incorporate nursing specific terminology and concepts such as nursing process, assessments, intervention, and evaluation. Then the 13th one is check for clarity. So review your response to ensure that your explanation is clear and well structured. Use proper grammar and punctuation. Then the 14th one is manage your time. Remember, it's an exam, so therefore time management is of important essence. So nursing exams are often time limited, so manage your time effectively to ensure you have enough time to answer all the questions. Then number 15, which is our last key practice point, which is practice with simple questions. So this can be done on a variety of conditions. So practice with simple pathophysiological questions and consider reviewing textbooks or course materials to reinforce your understanding. Remember that nursing exams may have different formats, including multiple choice questions, short answers, or essays. So tailor your response to the format of the question and the depth of your knowledge required to add additional information and also make it as a reference point. So this basically marks the end of our guide on how to write a pathophysiology. See you next time, and thank you for tuning in.